Welcome to our weekly PBA channel. My name is Karolina Nadolska. I am an Ayurvedic practitioner, and today we are back with Dr. Kamal. Welcome, Dr. Kamal.
Hello,
Nice to have
everyone.
you here.
Yeah.
Yes.
Happy to be with you again on the channel. Yeah.
And so today we're talking about a very, very acute problem because I've just learned that 25% of the world population is suffering from non-alcoholic liver disease. How serious is it? Please tell us more about it.
Yeah. So the main reason behind it that most of the times it is not diagnosed on the proper time because initially it doesn't show any special symptoms as in the other diseases. Like there is no pain or discomfort in the body. So
Mhm.
that's why it is one of the chronic and serious conditions to be noticed on time. So this is the main reason that a lot of the population is suffering from it, but still they don't know about it.
Yes, because I always, I thought in the beginning that fatty liver is usually associated with alcoholism, right? But this is
Yeah.
non-alcoholic. So people who actually drink very little or not none at all have fatty liver.
Sort of misconception we like have in our minds that most of the times fatty liver is just because of the alcohol, but it is just the opposite. So there are two types of fatty liver, and when one is alcoholic and the other is non-alcoholic, and the
Mhm.
most of the population is suffering from non-alcoholic rather than the alcoholic one. So
Very
it is
interesting.
difficult to diagnose. Yeah.
So it is connected to the civilizational diseases such as diabetes, obesity, right?
Right.
Anything
Right.
else?
Yeah. So basically, when we talk about fatty liver, like you might have heard this term fatty. When we call a human being as a fatty, it means the person has turned like a football or like in a rounded shape. So we
Yeah.
can just connect it like this with the liver as well. From
Mm.
its original shape, it just becomes swollen, like because of the excess accumulation of the fat cells in the liver cells. So that's the fatty liver. So it's a very simple definition for that. That whenever there is excess fat in the liver, more than that is required, it converts to fatty liver, and it comes in grades like grade 1 fatty liver, grade 2, grade 3, and it depends whenever like how much your cholesterol levels, your calorie intake, your insulin levels are raised.
So
So when you're yeah.
the causes for the fatty liver, sorry, are obesity, type 2 diabetes, anything else?
So I was about to tell you these causes only. So one of them is obesity, as you told us. So in the obesity, the fructose and the glucose, they are the main culprits. Whenever there is a high calorie diet intake, the level of fructose and glucose will go high, and the liver will crave more for it, right? And you will just start craving for more sweet things, sugary products, processed foods.
Mm.
And so in this way, obesity is one of the cause for fatty liver. Other than that, insulin resistance is there, high fat diet is there, bad lifestyle in which there is no workout, regular exercise is not there. Sometimes genetics can also play a role in this. So these are the very common causes, and of course, how can we forget the alcohol consumption, which is responsible for the alcoholic fatty liver.
Yeah, yeah. So yes, so many people are obese these days. I'm not surprised that this is the epidemic also. Wow.
Yeah.
What are the risk groups in for fatty liver?
So
If I was,
nowadays,
yes.
yeah, tell me.
If I was to, if I was worried, you said that there are basically no symptoms for fatty
Yeah.
liver. I read that sometimes you may have swollen hands, swollen throat,
Yeah.
or
So this
abdominal
is the
fat.
thing when the condition has aggravated to a stage that symptoms are blowing up and it's coming up on with your body. So
Mm-hmm.
when it comes to a stage that your body is not like overcoming it, coping with it by its own, like your own defense system is not able to fight about it. So now the symptoms like fatigue, general weakness is there, sudden weight loss can be there in such cases,
Oh,
general weakness, fatigue, yeah, and sometimes pain in the abdomen, in the upper right corner of the abdomen. And on the advanced stage of this, if we go, it can result into jaundice as well.
wow. And
Yes.
skin, I read also, right? Because the skin is always connected to liver in Ayurveda.
Right, right.
Yes.
Both are related
Okay.
to Pitta dosha as well. Yeah.
Exactly. Yeah. So, okay. So, how do we diagnose it if there are no symptoms? How do we go to a doctor and we just say, what do we say?
Yeah, that's what I told you. In the initial stage, you will not be able to diagnose it by your own or by your doctor as well. But if you are having those symptoms regularly on a regular basis for continuous of 2 weeks, 3 weeks, 1 month, or 3 months, your doctor will advise you a scan, abdominal scan, and that will show if the fatty liver is there, and it will also depict that which grade is there in your condition, in which stage you are at the time. So that is the
Mhm.
way you can diagnose that. Yeah.
So MRI or ultrasound?
Ultrasound. Yeah,
Okay.
ultrasound is the first stage. That only will depict if there is a fatty liver. No need to go for the MRI later on. Yeah.
Yeah. Oh, yes. Okay. Very interesting. So, if I am obese, if I have insulin resistance, and I have type 1, type 2 diabetes, any other risk groups that should really consult with doctor regarding the disease?
Yeah, so nowadays, what I have seen with my patients is that there is no age restriction with the fatty liver. Earlier, we used
Oh,
to think that, okay, so one group is the person who are consuming alcohol a lot, right? And the other one is if it is there in the non-alcoholic conditions, those patients will be more than like 40, over 40 years of age. But nowadays, there is no barrier of age. Even the 25, 26 years of age of persons and human beings I am seeing is like suffering from fatty liver. So just the processed foods that we are taking nowadays,
hmm,
a lot of processed foods, high calorie, sugary foods, bakery products, not doing enough exercises. So these are the things which are with the every age of person. So that's
sure.
why we can't judge if the person is 40 years or the 20 years, if he is suffering from fatty liver or not. So that's the main reason. We all are having same habits, same food habits, same eating habits. Yeah.
So, if you are not taking care of this problem of the fatty liver, what can happen to you?
So if it is left untreated, the condition of fatty liver is left untreated, there can be inflammation on your liver. Like your liver will be swollen, and it will, if there is swelling in your body, you know that, like, as a common sense, if we apply, if there is a swelling in your body after a particular period of time, you will start having pain and tenderness in that area, right? So you
Yeah.
will continue to have a sweet pain near the liver on the right side of your abdomen. So that is the main thing you will be, and later on you will be landing into serious liver disorders like
Like
cirrhosis.
cirrhosis, exactly.
Yeah,
Yeah.
yeah. So
Oh,
that's the main thing which we want to avoid in the initial stage.
okay. So this untreated could be really serious. We're
Yeah,
talking about serious
that's
condition.
important.
Yeah. Okay. What about Ayurveda? How does Ayurveda approach liver, fatty liver?
Yeah. So without talking about Ayurveda, our video is just incomplete. So
Yes.
definitely we will be linking our fatty liver condition with the Ayurveda. And liver, as we all know, is the site of Pitta dosha.
Mm.
Whenever there is an imbalance of Pitta in the body, there will be some liver disorders associated with that. So just to maintain that liver disorder, according to Ayurveda, we will be working on Pitta dosha if it is in excess amount. And it comes up in the forms of your blood test. Like if you will go for a liver function test, kidney function test, your liver enzymes might be raised more than the normal range. So these are the signs through which we can relate the blood test with the Ayurveda.
So
Whenever
inflammation,
you
right? That's for the liver inflammation. Okay, in your
right.
blood. Mm.
So whenever your bilirubin levels are high, liver enzymes are high, if we think about Ayurveda at that time, it means your Pitta dosha is getting imbalance, and we need to work on that.
Okay.
So in that way, we think about the treatment plan after that to balance all the Pitta.
Okay. And how do we do that in Ayurveda? Difficult
So,
question.
what
Individual, I know.
but this is the most interesting part as well, which all
Mm.
the listeners wait to listen at the end of the video.
Yes. Yeah.
What I think is that when what Ayurveda considers is whenever you are looking for a treatment for some disease, the first thing you should do is just go back to the causes.
Ah,
We call it Nidan Parivarjana, like reversing the causes. Just do the opposite of the causes that are causing your disease. That is the most important and the most effective way to cure the disease. So I'll start with the causes. We talk about obesity, right?
Yes.
High calorie intake, high fat diet, fructose, glucose, all these things play a role in that. So whenever you are not giving that particular thing to the liver, you are fasting and you are not giving enough glucose or fructose, it will just reduce the amount of fructose and the glucose stored in the liver, and it will start repairing itself. And one more thing, liver is a very interesting organ that it has a power to regenerate itself.
Exactly. Yeah.
Yes. So it gives you a second chance without getting some sort of surgeries or transplants. You have that time to reverse your liver disorder by giving it some time with the fasting. So first thing is fasting, right?
Okay.
Secondly, we talked about insulin resistance. As I told you, we need to decrease the sugary products, bakery products, processed foods in that. And after that, lifestyle is important. So have a regular exercises in your diet, in your routine, and then have try to include more of the pranayams, because whenever your liver is in a stress condition, stress wherever it is, it will worsen the condition, right? So just try to lower the stress levels. Just lie down for some time in shavasana and relax your body with that. Avoid overeating. Overeating is also a sort of stress you are giving it to the body, and again the liver will go into stress and a lot of liver disorders will be there.
I haven't found the statistics, but what do you think? More women or more men have this problem?
What I used to see a few years ago in my practice was men were on the higher side, but
Okay.
now I can see there is an equal ratio for both of them.
Wow. Very
Because
interesting.
it's not like that the women are not eating unhealthy food, they are equally eating that.
Yeah.
Not doing enough physical exercises, that was there in ancient times. So everything is like, electronic, machine based, no need to give some stress to your body while doing the things. So
Yeah.
it's just becoming sort of equal ratio in men and women nowadays.
So actually, the non-alcoholic fatty liver, it's a very useful disease because it reminds us to go back to the healthy lifestyle, right? Exercise, eat healthy, non-industrial food, not too much sugar. I like
Right.
it.
And when we talk about Ayurveda, Ayurveda is all about the food you should eat, the food you should not eat. And after that comes the medicine part, the herbs that can help you with the detoxification of liver. And yes, liver detoxification is a thing nowadays, which nowadays everyone is concerned about, and they are just doing it, every single thing they are seeing over the internet just to detoxify the liver. Because I have seen people in my like personal environment that people are there, they know they can't just skip alcohol in their life, right? But on the other side, they just want to have an alternative to have a clean liver as well with the
Difficult.
detoxification of liver. So they just
Difficult.
want to balance things.
Yeah.
Yeah, they're not ready to, remove alcohol from their life, but they want a solution with the detoxification. So
Okay,
for
so
that,
if we are not such Puritans and if we drink alcohol, we drink a couple of glasses of wine a week, how do we balance that and keep our liver relatively healthy?
yeah. So Ayurveda says that there are some sort of drinks, some sort of alcoholic drinks as well, in which Ayurveda has some medicines as well, like asva and arishta. They are made by fermentation, right?
Okay.
As the alcohols are made with the fermentation. So it depends on the prakriti or the metabolic type of the person. If the person is vata, pitta, or kapha, so
Ah.
what sort of drink you can have? Like, because some, like you told about me about wine, so it
Mhm.
is some sort of pitta increasing drink. So pitta prakriti person should try to avoid more of the wine drinks.
Ah. What
Yeah,
do we
so
drink instead?
a very good topic, and will definitely I would like to talk about in some other video with you.
Okay.
Yeah. So other than that, as I told you, you need to avoid more of the glucose and fructose. I'm talking repeatedly about it just because they are the main culprits in this thing. So the opposite of this sweet glucose and fructose is the bitter taste.
Mm.
And the top of the list is bitter gourd, like Karela is there
Yes.
in our food, which
Gourmand.
has,
Yes.
yeah, it's a very powerful liver stimulant. And it has some enzymes that help to detoxify the liver as well. You can use it in the form of vegetable. You can have it the juice. The other thing is the bitter leaves of neem. You can have
Oh,
it in the
yes.
form of juice, neem juice as well.
Ooh,
So other
very
than that,
bitter.
garlic is there. Yeah. So garlic is there, turmeric is there, walnuts, green tea. So these are the things you can add in your daily routine so that on a regular basis your liver is getting cleansed.
So
Sorry.
basically herbs that are either yellow or orange in color, right?
Yeah.
Anti-inflammatory and
Yeah.
and bitter.
Anti-inflammatory, right?
Yeah.
And
Okay.
most of the important thing is they should be bitter in taste. Like, so when we talk about herbs, punarnava is there. It is a very good liver tonic. We have punarnava tea in the market as well. It detoxifies the liver and reduce inflammation on the liver. After that, kutki is there. So these things are very helpful in cleansing the liver on a regular basis.
With kutki, I heard that there are some problems with harvesting that herb because it's almost on the verge of extinction in Himalayas. So I read somewhere that you shouldn't really get kutki. Is there a supplement or is there a substitute to kutki that you can recommend?
But what I think is India is never short of these herbs. You
Ah,
can always buy from
proud
India.
Indian. I know you are. Okay.
So we have this on our soil in a very large quantity. Don't worry about that. But still,
Okay.
if we think about kutki, you are not getting enough kutki at the time you need it. You can just have a lot of alternatives for that. A lot of herbs that work similar to kutki are there. As I told you, punarnava is there. Milk thistle is very famous nowadays.
Okay.
You can get it easily. You can
Yes.
get the capsule form
Yeah.
as well. So it's not like that if one herb is not available, you will be getting like not getting enough benefit out of that.
Sure, sure. What about Amalaki? Is it good or not so good for that
Yeah,
condition?
Amalaki is like a lifesaver herb in Ayurveda.
Yeah, I love it.
It's anti-aging. It's good for the eyes. It's good for diabetes. Like I can't count a lot many diseases for that.
Yeah.
But
Okay,
what
great.
I would like to advise the processed food, what I am also experiencing in this country after coming here, that you have to use it at some point or the other.
Yeah.
But whenever you are tearing a piece of packet of your processed food, you are tearing a piece of your liver along with that. Just remember that whenever you buy that or see that, try to avoid as much as you can. I'm not saying just, finish it off completely. I know it's not possible, but just have a quick look on the ingredients and then buy wisely the product good for you.
Please repeat that very, very wise sentence because for diabetics, this is also death. Yeah.
That's why. So yeah, the same sentence you're asking me.
No, I was just saying that repeat one more time that sentence.
Yeah.
No
So
processed
whenever,
foods, please.
yeah. So it can be a big tagline, no processed foods.
Yeah, we'll have it. Okay.
Definitely.
So, to summarize it, healthy lifestyle, exercise, pranayam, and avoid stress, avoid industrial food, and just live healthily ever after.
Because I think liver is an organ with a blessing. You have a lot many chances to not to destroy it. You have many chances to improve the health of the liver. And it's
Yeah.
easy to tackle other than like organs like kidneys and the heart and the lungs. It's quite easier if you manage it on time.
Yeah, very wise words. Yes, absolutely. Okay, so thank you very much, Dr. Kamal. And remember, next time we're talking about alcohols per each dosha. This probably will be the most popular program for
Definitely
PBH.
try to make a good video on that with you.
Okay, great. Thank you very much. How is Australia treating you, by the way?
Yeah, it's quite confused weather here. In day it's 40 degrees and at night it's again 12 degrees. So you can't just keep your winter clothes inside. You just keep both of them out of your cupboards here.
Don't complain, you have 20 degrees. We have winter here and it's -1 and snowing.
Then I'm better.
Yeah, much better. Okay, thank you very much. Please remember to subscribe to our PBA channel and take care. Namaste.